about how to be brave enough to have the conversations that matter in healthcare, and then we're going to lunch, and then we'll be back for a great afternoon. So we'll stay. Welcome on board.
How you doing? I don't know how loud I am. It's hard to follow that group, but I'll tell you that that panel is what we call force multipliers. So my name is Torres. I'm an emergency care nurse practitioner. Prior for about 15 years. Thank you for this opportunity. While customer satisfaction is not nurse to patient ratio, both are huge. Can you hear me? Sorry about that. Should I start from the beginning? Thanks for the opportunity. While nurse two, while
All right, we're back on schedule.
customer satisfaction is not nurse to patient ratio,
It was great. It was great. Thank you.
both are huge problems within healthcare.
Great.
Problems no one wants to address, and why you, the brave, are here to start a conversation that matters. And to those who think that you're too small to make a difference, a bit of advice. Try being a mosquito in the room. These are the objectives. First, participants will be made aware that the current path healthcare is being taken down is not good for healthcare. Healthcare workers or patients. Second, participants will appreciate that by putting healthcare and healthcare workers first, everything else will fall into place to improve customer retention, profits, and most significant, a safe workplace. I will not be discussing any investigational and or off-label use unless a healthcare worker pushing back is considered off-label. I do receive royalties from book sales, but have no other financial relationships to disclose. This is going to be a provocative presentation about the elephant in healthcare's exam room. I hope you still have a job tomorrow. As I have worked for more than 30 employers as a nurse practitioner in the last 15 years, not because of incompetence, breach of duty, or negligence, not because of injury, disability, or death to a patient, not because of prejudice, alcohol, or drug addiction, not because I am unreliable, cannot be trusted, and or undermine those I work with, and not because I do not care or lack compassion. I have worked for so many because I will not bow to exaggerated, unrealistic, emotional expectations. And despite warning, given an explanation, I persist. I am a nurse. I am not a bellboy at your favorite resort looking for a tip. I am not a cashier at Chick-fil-A whose script it is my pleasure. I am not a hospital CEO taking satisfaction scores. And most definitely, I am not anyone's punching bag. Not to patients, not to families, and not to administrators either. Like you, I'm a patient advocate and a member of a time-bound profession, responsible to care for the sick, promote health, prevent illness and injury, and maintain levels for others. It is our responsibility, and not anyone else's, to cultivate our profession and steer it in the right direction without compromising healthcare workers or patients. Healthcare's best kept secret is that customer satisfaction scores are not about healthcare, but about customer retention for profits. As studies show, there is no correlation between satisfaction scores and good healthcare, yet satisfaction scores are the driving force of healthcare. A driving force without accomplishment, I must add, because despite all the money, time, and effort invested, satisfaction scores have not added anything to healthcare except an overwhelming amount of collateral damage. Healthcare is generally dedicated to helping others and obligated with saving lives and stomping out disease. Despite that heritage and duty, healthcare has been cheapened by any means necessary and at the cost of so much into just another customer-driven service. However, healthcare is like no other industry, none. And the only industry with patience, the only industry with our waiting room, the only industry where services are sought during some of the worst moments of our lives and during inconvenient times for uncertain, unpredictable, and volatile choices in places that are unknown, unpleasant, and unforgiving. The only industry where, regardless of disposable income or time, services are sought after and rendered. The only industry whose workers maintain the public's confidence year after year, as the public has recognized us as the most honest profession and with the greatest ethical standard of any industry. Technical difficulty. Most significant, or I lost my, unfortunately I don't have the gift of talking off the cuff. We're almost there. Most significant, healthcare is the only industry where workers go to battle for every so-called customer. And if so-called customer succumbs, we cry for them as well. As the overwhelming number of patient experiences are rewarded for both healthcare workers and patients. Yet the melodramas of the complaining minority are permanently etched in our memory, some physically scarred. It is that misery and frustration which drags us down, as we must navigate that minefield alone. Just to stay safe and or keep our jobs. Reason enough as to why so many need healthcare and not fatigue, as no one fatigues from helping others. How did we get here? In the 1980s, healthcare administrators found a new frontier, healthcare service excellence. Since the belief has been that by increasing customer satisfaction, healthcare's quality and costs would improve. The strategy healthcare will learn how to deliver great service from the service industries by taking their ideas and standardizing them for healthcare workers with the ideology that healthcare workers are just like waitresses. Today, some of us wearing costumes, borrowing stethoscopes. 30 plus years and billions of dollars invested, healthcare has nothing to show for that ideology. Why? Because rather focus on variables that would improve the quality and cost of healthcare, such as outcome and the safety of healthcare workers and patients. Satisfaction surveys focus on wait times, pain management, housekeeping, and communication skills, none of which improve the quality or cost of healthcare. What collateral damage? Healthcare centers unable to keep up with the competition, closing their door, leading to overcrowding, deplorable circumstances, and catastrophic outcomes elsewhere because of increased wait times, treatment delays, nursing workloads, and medical errors. In 2011, the Centers for Medicare and Medicaid Services paid out $226 billion on overtreatments that did not benefit anyone. Waste that does not include the hundreds of millions wasted on luxurious lobbies and valet services. Waste that does not include having safe nurse-to-patient ratios. Waste that does not include the billions lost to healthcare-directed violence, a violence that has become more frequent, more brazen, and more violent. And our professional and government organizations have nothing to offer except feel-good policies that are impotent as they purposely fall short as to not offend patients or families. Healthcare workplace violence is an underreported, ubiquitous, and persistent problem that has been tolerated and largely ignored. Why? Because the first thing administrators ask is, what did you do to piss off that patient? Healthcare pundits tell us that healthcare-directed violence is a rare occurrence at the hands of the demented, psychotic, and those under the influence of alcohol or drugs. I say it is not. I say it is more common than not, and not from those listed, but instead from those who did not get what they wanted, tired of waiting, missed their honey bunny, thought it was too noisy at the nurse's station, or whatever flavor of the week it is. Isn't it sad the industry on the forefront of fighting domestic violence finds itself in an abusive relationship to include justifying the violence and siding with those who are abusive towards us? What was that? All for what? As studies show, the most satisfied patients not only spend the most on health care, they are most likely to be admitted and most likely to die. Those are but a sample of the overwhelming collateral damage left behind. Now, I wrote the customer's satisfaction, the customer's never right, a nurse practitioner's perspective, not as a disgruntled worker despite the 30 jobs, but because it is the story of healthcare, where healthcare administrators rather follow than lead, claiming that's what they're doing up the street, and so will we. None having the testicular fortitude of going at it alone. Since writing the book, I wish I had thought of a better or more bolder title, like Make Healthcare Great Again. This tolerated and largely ignored silent national crisis is not political, as we only have healthcare submissive, altruistic, and accommodating culture to blame. Not only do we follow the herd, but we turned over the reins. And since outsiders have taken healthcare in the wrong direction, with their ideology that it's in the patient's best interest, is taking healthcare back possible? Absolutely. Plagiarizing Albert Einstein. Healthcare will not be destroyed by those who take it down the wrong tracks, but by those who watch them without doing anything. To take healthcare, we must surround ourselves with those who are bold and on the same as us. To end this ignored and shameful silent national crisis that insults healthcare workers and patients. In his Day of Affirmation speech in 1966, Robert F. Kennedy said, "Few are willing to brave the disapproval of their fellows, the censor of their colleagues, the wrath of their society. More courage is a rare commodity than bravery in battle or great intelligence. Yet it is the one essential vital quality to those who seek to change a world which yields most painfully to change." The literature is inundated with articles that list a plethora of reasons as to why rating healthcare is unfavorable for healthcare workers, and patients. Yet no one is interested. But don't let me prep an area for a central line with betadine without JACO, the American Nurses Association, the American Medical Association, and the entire hospital staff, to include the unit clerk, from challenging that choice. The View did not wake a sleeping giant. They proved the public has no idea what we do. Yet we are asking them. Yet we are asking them to rate us. Albert Einstein warned us, we cannot solve our problems by using the same kind of thinking we used when we created them. Meaning, we must rid ourselves of traditional thinking to create the future. For this insanity to end, we must deflate everything customer service to nothing more than a byproduct of healthcare, rather its driving force. Healthcare needs change agents willing to go in a new direction, even if alone. A direction that promotes healthcare workers as valuable and trustworthy over concerns patients may take their business elsewhere. By no means am I suggesting patients cannot complain, as they are only venting their frustrations, anxieties, and feelings of powerlessness. Disagreement is not a hate crime or a crime at all. nor is it a lack of caring or compassion. Who of us is absent of disagreeing with those we love most? Yet in healthcare, where we attempt to preserve the quality of life and prevent the loss of life, it is customer service complaints that are the end all. Rather placate to customer satisfaction scores, healthcare would benefit most if we place all our energy, time, and money on clinical outcomes and the safety of healthcare workers and patients. A patient's tantrum behavior you and healthcare administrators would not accept at home. Yet healthcare administrators want us to accept that venomous behavior from those we are helping. I say, dismiss those who annoy us. Dismiss the rude, the entitled, the abusive, the demanding, and those who have taken us down the wrong tracks. By dismissing those who annoy us, it frees us to focus on those who care, value, and trust us for the care we give. To make healthcare great again, we must stand in solidarity and side with loyal employees and co-workers over outsiders, the petulant, unreasonable, angry, demanding, and those who tread on us. Do not confuse placating with advocacy, as indulging those who make unreasonable demands leaves us vulnerable. Lastly, we must get rid of the ideology that patients are customers, clients, or guests. They are not. They are patients, ill or injured, and only healthcare has patients. I am well aware of the wrath when we do not drink the Kool-Aid. Yet when administrators say to me, "You better pick your battles wisely, mister," my answer, I have. Because picking your battles is a position of convenience, as anyone who has fought any battle will tell you how inconvenient that is. Plagiarizing Mother Teresa, I alone cannot change healthcare, but I can cast a stone across the waters to create many ripples, to take healthcare back and steer it in the right direction, where healthcare workers and patients come first, and away from idiotic scripts and signage, standard uniforms, valet services, luxurious lobbies, 1-to-8 nurse-to-patient ratios, and placating to those who make demands on us. We need companions, not to take part, but to take over. Anything short of that results not in fatigue, but in frustration, as no one fatigues from helping others. The takeaway point: nurse-to-patient ratios negatively save money, while money is wasted on customer satisfaction, both with huge costs and risks to healthcare workers, and patients. Yet administrators are not troubled. And why resistance is needed to make healthcare great again. I know that I am not alone in these thoughts, and why I ask, don't judge my words, judge my intent. Thank you for the time, the attention, and the opportunity.